It really depends on how much there is involvement and what compartment is mostly like what I call like has the highest disease burden. So is most of the disease in the skin, or is it mostly in the blood? Is there like significant lymph node involvement, or is there minimal lymph node involvement? Are there other visceral organs involved or not? But in general, for very early stage disease, meaning if there are like few patches and plaques, or limited, or the disease involvement is limited to the skin, we prefer skin-directed therapy, and there's a wide range of skin-directed therapy that we offer, from topical steroids to topical nitrogen steroids, to topical retinoids, and then beyond that, phototherapy that also has a range from narrow bands to PUVA, what we call, and total skin electron beam irradiation. That's the spectrum, roughly, of like skin-directed therapy. A lot of times, if even early stage patients are resistant to skin-directed therapy or continuously have relapse, or their quality of life is compromised by our skin-directed therapy. For example, they have a body surface area involvement that is really hard to reach to put topical steroids, or their work schedule doesn't allow them to come to the office 3 times a week to get phototherapy. Then a lot of times we do a combination of skin-directed therapy and systemic therapy, which are either like oral medications especially for earlier stages, and then for later stages, then we go mostly to systemic therapies, which can be like oral retinoids or methotrexate or interferon, and then to more sort of more serious or more involved systemic therapies, which are either monoclonal antibodies or targeted therapies such as mogamulizumab, brentuximab, and there's like a lot of clinical trials right now that bring a lot of hope for new therapy for subpopulations of patients, so we can more and more customize treatment for our patients and needs. And then also there are monochemotherapy agents that we occasionally use, depending on, again, where the disease is most bothersome.